One of the most common misconceptions among couples is that IVF is the first line of treatment offered to them when there is delay in pregnancy. But in reality, that's not true. Because we as fertility experts recommend IVF only when the chance of getting the pregnancy is more through IVF. Hi, I'm Dr. Radhika, consultant fertility specialist at Birthright Rainbow Hospitals, LB Nagar. There are several factors which we look at before recommending the couple for IVF. The most important factor is the woman's age. Suppose if a female is aged more than 35 years and approaching 40, there is decline in the fertility potential because there is decline in the quality and the quantity of the egg. So because of that, these patients can benefit more through IVF. Next is the duration of the infertility. Suppose if a couple has been married for more than 10 years or 5 years and they have tried all methods of ovulation induction, follicular monitoring and IUI and still they are not able to conceive. Next we look at the female and the male parameters individually. In the females, we look at the uterus, the fallopian tubes and the ovaries, and in the males we look for the semen analysis and the DFI testing. So in the uterus, we do a proper 3D ultrasound to look at the endometrium and the myometrium. We identify the endometrium, whether it's a good endometrium, triple layer or not, and we look for any abnormalities in the uterus. Next, coming to the ovaries, we do a 3D ultrasound to identify the antral follicle count and also to look for any lesion in the ovary. Is there any cyst or the PCOD ovaries or the endometriosis, and we tell them accordingly which plan of management would be better to them. So this is the female evaluation. Next, coming to the male evaluation, we do a semen analysis test and a DFI testing. Suppose if a male is having azoospermia or severe oligosteroteratozoospermia, such patients will benefit more with TISA and micro-TISA through IVF. Next, we also look at the previous treatment history. Suppose if a patient has taken multiple cycles of ovulation induction and IUI and still not able to conceive, such patients can benefit with IVF as the success rate is little more in IVF. Next is the carrier screening. If a patient is having consanguineous marriage with previous history having a genetic abnormality child, or there is a family history of genetic abnormality in the family, or there are multiple abortions, then we can advise them PGT testing of the embryos in IVF, and then we can have a healthy child. Next, coming to the unexplained infertility. When all the parameters are normal, the uterus is normal, the tubes, the ovaries, the semen parameters are also normal, and we are not able to identify the cause of infertility, such patients can benefit through IVF. Next, we are advising IVF to couples who wants to delay their pregnancy and want to preserve their fertility potential, especially in career-oriented females and also in cancer patients. We advise them to go for ovarian stimulation followed by egg freezing so that these eggs can be utilized in future for preparation of the embryos through ICSI. So IVF is not the first line of treatment which we offer to them. We evaluate both the couples individually. We tell them this could be the reason of infertility. We give them all the options of treatment, and based on their financial and emotional needs, we give an individualized plan to them. Thank you.